Hi everyone, welcome back to Alpha Nutrition. In today's video, we're going to be discussing the impact of pre-exposure prophylaxis, PrEP, on sexual activity. PrEP is a medication that can reduce the risk of HIV transmission, and it's often taken by people who are at a higher risk of contracting the virus. But, what are the effects of PrEP on sexual activity? First off, it's important to note that PrEP does not protect against other sexually transmitted infections, STIs, so it's still important to use other forms of protection. On the other note, studies have shown that PrEP can increase sexual activity among those taking the medication. This is likely due to a decreased fear of contracting HIV, which can lead to more frequent and casual sexual encounters. PrEP has been shown to improve the overall sexual experience for many people since it reduces the fear and anxiety surrounding HIV transmission. The researchers have examined data from several randomized controlled trials that evaluated PrEP's efficacy and safety. It is expressed in the study that there is no found evidence of increased sexual risk behavior or changes in STI incidence rates among participants. The study also stressed that PrEP use led to increased condom use, which can help prevent the transmission of STIs and HIV. PrEP users were also more likely to get tested for HIV and other STIs regularly. Research findings suggest that PrEP is an effective tool for HIV prevention that can be used safely without negatively impacting sexual activity or behavior. Truly, it's important to note that PrEP should not be seen as a replacement for other prevention methods, such as condom use and regular STI testing. PrEP medication should be used as part of a comprehensive HIV prevention plan that includes multiple strategies. It's also crucial to remember that PrEP does not protect against other STIs. So it's still essential to practice safe sex by using condoms and getting tested regularly for STIs. It's also worth noting that PrEP is not a one-size-fits-all solution. It's important to work with a healthcare provider to determine if PrEP is the right choice for you and to discuss any potential side effects or concerns. Additionally, it's important to be open and honest with sexual partners about PrEP use and to communicate about safe sex practices. In conclusion, PrEP can have both positive and negative effects on sexual activity. While it can lead to more frequent and enjoyable sexual encounters, it's still important to use other forms of protection and to discuss PrEP use with a healthcare provider. Since its introduction in 2012, the medication has become increasingly popular, especially among men who have sex with men, MSM, transgender women, and other groups at high risk for HIV. One of the main reasons for the popularity of PrEP is its ability to give people more control over their sexual health. This newfound freedom has been liberating for many people, allowing while the use of PrEP has been associated with changes in sexual behavior, and above everything, it is important to note that the medication does not protect against other STIs. Individuals who engage in condomless sex while using PrEP may still be at risk for contracting STIs such as chlamydia, gonorrhea, and syphilis. According to a study conducted by researchers from the University of California, San Francisco, the use of PrEP has not been shown to reduce sexual activity, increase high-risk sexual behavior, or lead to more sexually transmitted infections, STIs. This PrEP medication can also have psychological benefits. For those individuals who are at high risk for HIV, the fear of transmission can be a constant source of anxiety and stress, and the help of PrEP medication, it can alleviate this fear and allow individuals to feel more in control of their sexual health. This newfound sense of control can lead to increased self-esteem and a better quality of life. For that reason, regular STI testing is still important for individuals using PrEP. Healthcare providers can also provide guidance on how to properly use PrEP and what to expect while taking the medication. While PrEP has been shown to be highly effective in reducing the risk of HIV transmission, it is important to note that it does not provide protection against other sexually transmitted infections, STIs. In fact, research has shown that individuals taking PrEP may engage in riskier sexual behavior due to a false sense of security. With that being said, it is recommended that individuals taking PrEP also use condoms to reduce the risk of STIs. It is paramount to note that while PrEP is highly effective in preventing HIV transmission, it must be taken consistently to be effective. Absolutely, it is recommended that individuals taking PrEP should take it every day at the same time to ensure maximum protection against HIV. If you have any concerns about how PrEP might affect your sexual activity, it's best to discuss them with a healthcare provider. They can provide personalized advice and guidance on how to use PrEP safely and effectively. Most importantly, individuals taking PrEP should be regularly tested for HIV and STIs to ensure that they remain healthy and infection-free. Also, by educating ourselves and others about PrEP, we can work to reduce the stigma and misinformation surrounding this important medication and help promote healthy sexual behaviors for all. Thanks for watching, and we'll see you in the next video.